Oh. Okay. Whoops, there you are.
Very
Hey.
good?
Yeah.
Yeah. So what you have is lung cancer.
Okay.
And it's called adenocarcinoma,
Okay.
which is the most common lung cancer we have so far. The treatment in general for majority of people is chemotherapy plus immunotherapy. All of them are given IV, usually once every 3 weeks.
Was that infusion thing? I saw something online, and they have a bag kind of looks like an insulin thing.
Right.
Now, will I be able to drive afterwards? Maybe if I settle down and rest?
Yes, you will be able to drive afterwards.
Okay, good.
But you may feel more tired in the following week.
Yeah.
Usually not right after the treatment.
Oh, okay.
That's why you can drive out afterwards. But for the next few days, you may go downhill and then pick up, right?
Okay.
There are some variation to treatment plan depending on whether your marker for immunotherapy is high enough.
Okay.
If it's high enough, especially more than 50% when we stay it, you can benefit from just doing immunotherapy without chemotherapy.
What kind of therapy?
Immunotherapy.
Immunotherapy.
Right. We'll talk more about the details, but just to give you an outline.
Okay.
If there is any specific mutation we can see on your lung cancer, then you may qualify for some pills that we call target therapy. So I have to request those tests on your previous sample.
Mm-hmm.
I have requested, but it takes up to a month to come back. So I do not have it yet.
I see.
In the meanwhile, we should go ahead and treat you because you're having so much symptoms.
I should go ahead and do what?
We should go ahead and do the treatment with chemotherapy and immunotherapy because you're having so much symptoms.
What about all these lymph node things?
Right. So regardless of what eventual pathway we're going to go down, the chemotherapy and immunotherapy should help you with controlling the symptoms now.
Okay.
And we can change the treatment later on.
Okay.
If we have more information coming.
Okay.
But we plan to start you on treatment next week.
Sounds good.
You already have it scheduled.
I do?
You do. You are going to have a video call with our nurse practitioner next Monday.
I'll be here next Monday?
No, video call.
Oh, video call. Oh, that's the one that I should have had in the beginning. At least that's what they told me.
Right. And that will discuss the details of chemotherapy, immunotherapy side effects and how to handle them.
Okay.
That's the Monday call. Then on Wednesday, you're going to come in for treatment. IV.
Okay.
IV. Okay?
Oh, just the IV.
IV.
Not a big thing in here.
Well, this thing needs to happen, but we don't have to have it to start treatment.
Okay, good.
We'll see how you like the peripheral vein versus here.
Yeah.
We can do the treatment initially with here.
Yeah.
But then later on, if you think, okay, port makes more sense, let's do port then.
Yeah. I just shouldn't have it this way.
Yeah, we'll see how things are.
Okay.
But that's the plan, to start IV treatment next Wednesday for you.
Sounds good. Sure.
Then the degree of the disease. It's not in the brain. It's not in the belly or pelvis.
I see.
Or bones. But you have significant disease in the chest.
I understand.
And that's causing a lot of fluids accumulation, trouble breathing, block of the bronchioles, so the lung kind of collapsed because the fluid is compressing on, and also because the mucosa was swollen, so the windpipe was like closing up. All of them are contributing to your feeling of trouble breathing. And you also have lymph nodes in the middle of the chest get involved.
Correct.
Right. So these are still considered as stage 4 lung cancer.
Phase 4. Well, that's advanced phase, isn't it?
It is advanced stage. Even it's really just in the middle of the chest. But because it has involved the pleural, causing pleural effusion, That's why you are stage 4.
Oh, okay.
And usually in this case, surgery does not help.
Uh-huh.
Radiation doesn't help for most of the cases either,
Okay.
unless there is a very focal spot
I
that we
understand.
want to control, open up, or doing the pain control to some bone lesions, things like that, which is not your case. So what you are gonna do is really systemic treatment, mainly gonna be chemotherapy and immunotherapy next week.
Oh, okay. I understand.
Yeah.
So next week Monday I got a video conference,
Yes.
and then Wednesday I come back here.
Right.
Okay. And they'll set up the time and everything.
Right.
And that's when I'll start the therapy next Wednesday.
Yes. But today, let's get you to the ER,
Yes.
drain the fluids out,
Yes.
so that you'll feel better. And I'm gonna have my triage nurse to work on setting up a home oxygen for you.
Set up a what?
Home oxygen. Oxygen at home.
Oh, with the big tank or something?
Yeah. Yeah.
Okay.
Just in case you will need it in the future, because here's the thing. The symptoms may not get better immediately after the chemotherapy, right?
Okay.
It may take at least 1 or 2 cycles to really get better, right? So it takes time. And in the meanwhile, what if things do go south before they get better? You will need extra help. So let's set up some oxygen for you so that you will not suffer, right?
Now I take that tank with me wherever I go?
It depends on how you feel,
Oh, okay.
right? If you feel fine, if your oxygen level is okay, you may not necessarily need it, right? This is really just for backup, right?
I understand.
I assume you'll feel better today after the fluids is drained,
I'm sure I will.
right? So that's very important to support you when we're getting the chemotherapy still,
Sure.
trying to get it. So the chemotherapy are 2 medications together. I think I print out them for you. Do you have them?
You printed them out?
Yes, in the hospital.
I keep everything, and I got, well, I don't know if I have them.
Okay.
I must have them somewhere.
Okay, I will print out one for you again.
Thank you.
And are you taking a vitamin called folic acid?
Yeah, I'm taking a total of 6 now. The folic acid, and then the other, and then there's two more. Shoot, I think I have those in my car. Oh, I got them on my phone. Hang on then.
You can hang up. You can
Oh, let me
stop
put
for
it on
now.
pause.
I'm just gonna printing out.
And let me put it on.